I'm Bill Hoffman, Communications, Department of Laboratory Medicine and Pathology. I'm here with Dr. Stephen Hecht. Dr. Hecht is Professor of Laboratory Medicine and Pathology. He is the Wallin Land Grant Professor of Cancer Prevention, American Cancer Society Professor at the university's Masonic Cancer Center, and among his many honors was the Dean's Distinguished Research Lectureship in 2017.
I grew up in West Orange, New Jersey, on the slopes of the Orange Mountains that you probably never heard of, but that's in North Jersey. And I could look out the back window of my house and see the New York skyline. And actually sometimes I thought about, because this was in the 1950s, so it was the height of the Cold War, sometimes I thought about looking out there and seeing the mushroom cloud. But anyhow, I suppressed those thoughts. I ventured south from New Jersey. It was a suggestion that my father made. Why don't you apply to Duke? That's a decent school in the South. And I did that, and that's where I ended up. So I knew I wanted to do chemistry. I had been doing chemistry since high school. When I was a senior in high school, we did Continental Classrooms, so that was a TV show. We would get up early at around 6 a.m. and then watch this show on TV with Professor Baxter, I think it was. And then we'd go into school and discuss it in our chemistry class. So I knew I wanted to do chemistry, and when I got to Duke, I continued that, and things went well, so I knew that I wanted to keep doing chemistry, and I liked organic chemistry very much. So I decided to apply to some of the better schools that had graduate programs in organic chemistry. So that's why I chose to apply to MIT and Harvard and a couple others, and I ended up going to MIT. And I knew I wanted to do chemistry, so I kept doing that. And when I did my first postdoc appointment, I did it also at MIT in the field of mass spectrometry, which was very prominent in the biomedical area, but that's not what I was doing. We were actually doing more geology, because our goal at that time was to be able to analyze, using mass spectrometry, the rocks that were going to come back from the moonshot. So this would be the first time that man landed on the moon. I believe it was 1969. So we would analyze these rocks to see if there's anything there that looked biochemically significant. I never got to do that because I had left by the time the moon rocks came in, and by the way, they didn't find anything. But I always had this interest in applying organic chemistry to something biomedical, but I had no idea how to do it. And ultimately, I wound up at a small foundation in New York City, the American Health Foundation, that was focusing on cancer prevention. And they were doing a direction in the analysis of tobacco that I thought I could contribute to with my background in mass spectrometry. So that's how I kind of got into biomedical research through the American Health Foundation. In the 1970s, we identified cancer-causing agents, or carcinogens, in tobacco products. My colleagues and I identified the so-called tobacco-specific nitrosamines, which are strong carcinogens that are present only in tobacco products and not found anywhere else. And we also investigated, along with others, the polycyclic aromatic hydrocarbons, the best known of which is benzoate-pyrene, which are also well-known chemical carcinogens. So that's how we got things started in the 70s. And then in the 80s, we started to investigate the metabolism of these compounds in laboratory animals to try to understand how they actually worked. And then in the 90s, we used this information to develop biomarkers that could tell us about the human uptake of these cancer-causing compounds. So I think this was a great advance because we began to understand how the cancer-causing agents in tobacco products actually came into the human body and actually caused cancer. And so we were able to understand this process first by studies in laboratory animals and then moving into human studies. And then we were able to develop biomarkers that we could analyze in human urine or in human blood that indicated the uptake of these cancer-causing agents. And I think one of the most significant things we did was to look at people exposed to secondhand smoke. So when we were doing this work, secondhand smoke was still a huge issue. It's not anymore because you would never find smoking indoors anymore. But that was not the case in the 1970s and 1980s. And we were able to show the uptake of some of these tobacco-specific cancer-causing agents in people exposed to secondhand smoke, non-smokers exposed to secondhand smoke. So this had a great impact, and the whole secondhand smoke exposure idea has really helped to drive the social unacceptability of smoking. You never see smokers anymore inside, never. And now we barely ever see them around here outside. Hardly ever do we see secondhand smoke exposure, or do we see smokers. So the percentage of smoking is down now. It's in Minnesota, it's less than 15%. And in the country as a whole, in the US, it's about 15%. Whereas when I came into this field in the 1970s, it was 60 to 70%. So smoking has really gone down, and we're just one small laboratory in this whole smoking and health picture, but I think we contributed greatly to this with our discovery of the carcinogens and their biomarkers. So this has driven smoking way down. And then if you look at lung cancer incidence and mortality, that's also going down, and it follows by about 30 years the curves for smoking. So I think we've made a great advance in this area, but there's still a lot more work to do. Our goal is to be able to come up with a panel of biomarkers, things we can measure in blood or urine, or genetic changes that we can measure in DNA, that will tell us who is susceptible. Because if we can do that, then at an early stage, we can target these individuals for screening, lung cancer screening, and also for smoking cessation and prevention. So we need to find out who these individuals are. And in order to do that, we are analyzing cancer-causing metabolites in their urine. We're looking at the changes in their DNA, so-called DNA adducts, where these are the addition products of the tobacco carcinogens to DNA. Very challenging, because you need extremely sensitive methods. And we have high-resolution mass spectrometry now in the Cancer Center that allows us to do this. So we're moving forward, but it's still a challenge. And we hope to be able to develop a kind of an algorithm that will tell us who is susceptible for lung cancer, because lung cancer is virtually incurable. I think that in less than 5 years, we should be able to do this, because we already have a lot of genetic information, chromosome 15, chromosome 19, P452A6, so that's already there. We have a whole panel of biomarkers that we can measure. The challenge is putting this together in a way that is really predictive, and we're not quite there yet. We're only in an ROC analysis, maybe at about 75%. We need to get to 90%. So I predict that within 5 years we should be able to do this. Well, I just love that when we finish a project. So, every big project is subdivided into many small projects. And I just love when we finish one of these small projects and get it written up and get it published. That gives me a great amount of satisfaction. And also, I love working with the people in our group and in our program. They're just so dedicated, and it's just so much fun to work with them and to hear their ideas, to discuss the ideas, and to be continually optimistic about what we can do in the future, to apply for the grants, get them funded. So working together with this team has been very, very satisfying, and I really love it. That's why I keep going.